Hi guys, I've got a really cool case to go through with you today. This guy was self-referred into the practice for veneers. The guy who does veneers referred the case to me just because he's got a class 3 incisal relationship. Obviously, you'll see from the photos that it's impossible to go straight for veneers. So what we did was do pre-ortho and then go for non-prep veneers. This is how it all went.
Okay, so let's get right into it. So this is the case that I'm talking about. Let's have a look at his photos. So you can see just from the smile shot that we've got a reverse overbite there. We've got this canine which is all buccally displaced. He hates the look of this canine as well as these front 3 teeth. Okay, and that's why he came in for a consultation on veneers, and his plan was to sort out these front teeth with ortho first and then look at porcelain veneers to get like the perfect smile. And let's quickly just go to the end of ortho. So managed to get positive overbite, much better improvement, a bigger improvement in the way that he looks just here, and the teeth are ready for minimal or no prep veneers now. So let's go back to the beginning and I'll show you my thought process. So whenever you got this case where you got this reverse overjet like this, you want to see if the patient can get edge to edge, right? And he was pretty close. But the other thing that filled me with confidence was the look of this upper right lateral. If that's in the right place, then chances are we're going to get everything else pretty close around there. We don't have to deal with a lot of crowding in the lower arch, so that's a positive. Patient's only up for single arch treatment anyway. Okay, so let's have a look at the occlusal shot here. Whenever we stick braces on, we're going to get a little bit of movement buccally around here, which is going to give us a bit of space. But in his case, in Jack's case here, we're actually going to procline these incisors out here, and we're going to get a lot more space that way, actually a bit more than that, around there, hopefully. And that means that this canine only needs to come back a little bit, and just eyeballing it, it looks like there should be enough space that if these guys come out a little bit, this should have space to go in and become pretty well aligned. We've also got a little bit of space around here as well, which is going to help. As for the lower arch, it's pretty well aligned. Yeah, I agree, these guys are a little bit out, and it would make our job a little bit easier if we could just IPR and maybe tip these guys back in a little bit as well. But he's only up for single arch treatment. There's something weird going on here with this tooth. I referred him straight to the oral surgeon for that. It was pretty complicated and he had that removed. So let's have a look at what's going to happen. If we procline these teeth, they're gonna tip forward, and the incisal edge of your top incisors, which is probably down here somewhere, is going to come higher. Okay, because they're going to tip forward, and also the gingival margin is going to shrink. Well, is going to go a little bit more apically because we're tipping forward, and that's the new emergence profile of the tooth is going to push the gingival margin higher. So in this case, that would actually be a good thing because it brings us more in line with these guys here. This is artificially high, but you can see the gingival margin down here, and you can kind of predict how you want it to look at the end. Remember, we don't need to get things too perfect here just because he is having veneer treatment afterwards. So we need to get everything pretty close so that the prep with veneers is minimal to none. So in ortho, I find these buccal retracted shots are probably the most important shots. What I'm looking for really in this case, because he's got a normal overbite, his canine relationship here is very important. So we've got the mesial edge of the upper canine resting against the distal edge of the lower. So that's a class 1 relationship right there. So that's positive on that side. On the other side, it's a little bit more complicated. So we've got I can't judge the canine relationship here very clearly. So what I'm going to do is go a little bit further back, and we look at the mesial cusp of the upper 6, and that should be resting right here, right in between the two cusps of the lower 6. That would be a class 1 relationship. But everything is set back by half a unit. So he's half a unit class 3 on the molars. And there's the same relationship at the premolars that should be there, and it's a sort of a point-to-point relationship here, which is half unit class 3 as well. So it's reasonable to say that once this tooth comes down, it's going to be right on top of this premolar, which would make it a half unit class 3 again. Okay. Now, as the overbite is normal and one side is half unit class 3 and the other side is class 1, it's reasonable to assume that once these teeth are actually in the right place, that we could end up with a little bit of spacing in between the teeth. So from the outset, no IPR, because we know that we're going to have a bit of spacing at the end. There's a tiny bit of crowding on the lowers, which may increase the amount of spacing, but let's see what happens. So my plan here is non-extraction. Let's get the wires on, let's get the brace on, get the wires on, go from probably a 14 niti to 16 to 18, and then I've got rectangular niti wires, which you will see that I use towards the end. So here we have like the, we're a fair way through the treatment. I'll probably say this is looks like an 18 niti maybe, and there's two things I want to show you. First of all, look, we did end up with spaces, which we've got. So we've got power chain on to help close those spaces or move the spaces as far back as possible. The other thing to notice is that the wire isn't perfectly flat. It's higher up on this side than it is on this side, and all these incisors and lateral are being pushed up, pushed apically on this side. And the reason for that is something called vertical anchorage. This tooth needs to be pulled down, but as we're pulling it down with just the arch wire, then the side effect is that the other smaller teeth are going to be pulled up a little bit as well. And that's why you get this side is higher than that side, and you get this S kind of curve in the arch wire. The way to sort this out is just carry on, use a thicker arch wire, which is what I did a little bit later on. So let's have a look at that. So you can see this is coming towards the end of treatment. We've jumped the bite like the referring dentist asked us to do, and this little S curve in the arch wire is looking less and less. At this point, the patient's pretty happy with it. We've closed up all the spaces in between the teeth. We know we're going to go for veneer treatment afterwards, so a little bit of discrepancy here and there doesn't matter. So this is the photo that I just showed you. Here's the final debond photos. And we predicted there was going to be a bit of spacing. There was. We used the power chain to close up that spacing, and you can see a little bit of residual spacing has remained behind the canine. Patient was happy with this, it didn't bother him at all. On the other side, it looks a little bit neater. One thing I will draw your attention to is that we've had, I had bite razors at the front, so I'll explain how I used bite razors for this. And we've had some passive over eruption on the molars here, which has caused a little bit of an open bite here. Over time, that's just going to settle by itself, so I'm not really too concerned about that. The retainer goes all the way from the canine, which was displaced buccally, to the lateral on the other side. The reason I didn't continue it to this canine was that it was such a tight occlusion against the lower canine on here. So if I'd put something on here, it would just interfere, it would just keep breaking. So we've just kept the retainer from upper left 3 to upper right 2 in this case. So he was happy. We then sent him to his referring dentist. Now, unfortunately, I don't have the final veneer shots, but this is his trial smile shot. This was taken at the end of his veneer prep appointment. So, to the best of my knowledge, these are minimal or no prep veneers. We did have to use anaesthetic just because there was gum contouring involved. But apart from that, he wouldn't have had any anaesthetic. These veneers are so thin and they're very additive in nature. These are just made up in a temporary composite material to replicate what the final result will look like. Okay, so let's quickly just talk about this bite razor that I used. So if we draw the upper incisor something like that, and we draw a lower incisor, something like that. In order for this tooth to jump the bite, right, we have to increase the clearance. So we could potentially put you put a bite razor on top of one of the molar teeth back here, okay, and that would open up the bite at the front. But a simpler thing is actually just to put the bite razor behind the lower incisor, okay, so that it would actually be, you know, something like that, so that when he bites down, that is the that's holding the jaw open exactly the right amount. This tooth will now quickly jump the bite. As soon as it jumps the bite, we can get rid of this lower bite razor. If this takes a long time, you can get a side effect. This occlusal force pushing down on here can tip forward, and it actually, the tooth comes down and forward. You can get side effects on this lower tooth. So remember, we didn't have any appliance on this lower tooth. If you're worried about that during treatment, you can put a retainer on your lower teeth, and that will help reduce this kind of side effect. Great, okay, so that brings us to the end of our journey. So just a quick review, this is where we started off. We did all our planning, which is the most important thing about any ortho treatment, or any treatment really. We got the braces on, jumped the bite, straightened everything up to the best of our ability with the braces, took the braces off only after we got the okay from the referring dentist, and this is our almost final result on there. This was actually a different camera and with different white balance settings, so that's why this photo looks completely different in nature to the photos which I took like this.
Great, so I hope you found that video useful. I hope you learned something. If you liked it, you know, please hit like on Facebook, YouTube, wherever you're watching this. You know, feel free to share it with your friends and whatever. If you've got any questions, put them in the comments below. I'll try and get back to you as soon as I can. You can always get in touch via other mediums, Twitter, Snapchat, Instagram, whatever. I'm on most of them. If you're wondering what I'm using to organize my photos, just drop me an email and I'll pass you on some more information about that. Until next time, have a great day.